Last night we saw the devastating effect of a law in the Northern Territory that allows mentally impaired people to be jailed for an indefinite period. It focused on two men, Kerry Doolan, who's been in jail for 4 years, and Christopher Leo, who's been in jail for close to 5 years. Neither man has been convicted of any crime and they have no date for release. But the policy has arisen because the Northern Territory can't afford to build community-based mental health facilities with 24-hour supervision. Now there are concerns about the Northern Territory's capacity to deal with the increasingly complex mental health issues, especially in Central Australia. Some experts say the responsibility needs to be given to the Commonwealth. Lateline's Suzanne Smith filed this report and the producer is Alison McClymont.
In last night's Lateline program, the Deputy Chief Minister of the Northern Territory, Delia Lawrie, had this response to the terrible plight of Christopher Leo and Kerry Doolan.
What I'm advised is we've got about 6 in the jail system and obviously 3 sitting out in the community care, residential environment with 24-hour supervision.
Her claims raised the ire of McKinlay, the prisoner's legal guardian.
She's wrong in a number of areas. Firstly, in the numbers, there's definitely 7 in custody to my knowledge. There may be more. She's incorrect in saying that some have been supported in the community. None under custodial supervision orders are being supported in the community whatsoever. I believe she doesn't understand the issue and has misled the public.
The real need is for supported accommodation in the community, and those services just aren't there.
Both Christopher Leo and Kerry Doolan are thought to have been born with fetal alcohol syndrome. Dr John Boffa says excessive drinking in Central Australia will lead to a rise in alcohol-induced mental illness and fetal alcohol syndrome.
We're heading over the next 10-15 years for another cohort of young people and young adults who are going to be very much at risk of having a combination of mental illness, perhaps lack of brain development.
The Health Minister, Con Vatskalis, denies his government is ignoring the warnings of the medical fraternity.
We prepare for that one, and we're actually putting in place both the doctors and the expertise to identify the problem. At the same time, we've got the people and the expertise to try to address the problem that may arise in the future.
The coalition states are pushing for the Commonwealth to take control of all funding for remote NT Indigenous programs. The Deputy Chief Minister headed for Canberra today to argue against the move.
Have a look at the Productivity Commission report, the first national report that analysed Indigenous expenditure by all state and territory governments independently. What that shows is that the Northern Territory spends 53% on Indigenous Territorians.
But this figure is disputed.
The Territory spends about a bit over between 30 and 33% of its budget on Aboriginal people. It claims to spend about 55%.
Professor Rolf Gerritsen says the 10 marginal electorates in Darwin get the majority of funding and much of it goes on things like boat ramps.
The current government has exceeded even the CLP in its pandering to the weekend fishermen. I mean, this is a bit of a sort of a religion in Darwin. They don't have God in Darwin, they have a 12-foot aluminium dinghy and they worship it on the weekend.
He says the Commonwealth should take control.
I mean, I think a better solution would be if the responsibility for Aboriginal affairs was handed over completely to the Commonwealth, and if you like, the Commonwealth ran a parallel administrations.
In the meantime, McKinlay is stepping up the pressure on the Northern Territory government. He is visiting the abandoned St Mary's site in Alice Springs. It was once used to care for intellectually disabled people. The Northern Territory government acts the funding.
Christopher Leo and Kerry Doolan could be supported under this type of program on a campus such as St Mary's. Not necessarily exclusively, but this would be an ideal site if it was available.
Suzanne Smith, Lateline.